Also respect that the body is still, there's so many mysteries and so many things we don't know, that things can happen. And I think as physicians, we should never completely take anyone's hope away, because we've seen so many different things happen, especially with stroke victims too.
And the point here is that no matter what happens to you, there's hope. I do want to really quickly go to the magic wall and explain to everyone what exactly is going on in your body when you suffer a stroke. And Kevin's symptoms, obviously, very unique scenario, but so many people are at risk for stroke. And hey, blood circulation goes anywhere and everywhere in the body. I'm going to show you an example here of a stroke that would start in your heart. A little blood clot can form, for instance, in your heart. This is what you're seeing here. This little blood clot seems like no big deal, right? Well, if a blood clot breaks off from, say, your heart, your carotid artery, an aneurysm, any area before the brain, it can get dislodged and land in your brain. And what happens is, anywhere beyond that clot, no blood flow goes. There's no oxygen. So you end up with this big area of your brain tissue, essentially, that dies because it gets no oxygen. And wherever that happens, whatever part of the brain that blood clot hits, those dictate the symptoms. It may happen in the left side of your brain. You can't move the right side of your body. And if it happens to the right side of your brain, it may affect the left side of your body. If it happens to the back of your brain, we talked about it. You might have everything from difficulty speaking, no balance, vision problems. And that's why if you feel, and Kevin, it took you a few times, but if you feel something come on suddenly, and it is bizarre, it makes no sense, and your friends or family are with you, make them take you to the hospital.
I know. Just, you know what? It is that male ego. And I was in complete denial. I knew something horrible had happened. Here I was sitting in the car for 15 minutes before I called my fiancé and said, you know, I'll drive home.
And you're right about
just a complete idiot, seriously. Listen to the voice.
Listen to
We all
the
have that
voices.
voice. For me, I believe it was God saying, you know what, don't let him crack your neck. You can call it, you know, I've got atheist friends who sit there and go, I wasn't God. And I go, then call it a gut feeling. Because how many times you walk down the street at night, you go, I'm going to take this shortcut, and you go, nah, I better not do that.
And it's
We all have that.
Listen to yourself.
Listen to it. And it was there, and I just didn't pay attention.
And it happens, and it's really so common, so it's great that you're here, because every 40 seconds, people don't realize every 40 seconds someone suffers from a stroke, and 80% of them are preventable.
If you get to the hospital in time, yeah.
Exactly, FAST, that acronym
drug,
FAST
yeah.
that we've talked about before. If you see somebody, you look at their face, and if you ask them to smile and that smile is drooping, if you have them lift their arms and one of their arms is drifting down, again, the speech, which you were talking about, that's what the S stands for. If you ask them to speak a simple sentence and they slur it or it doesn't make any sense, again, this is the time to call 911 and get to the hospital and act fast.
But living proof right here in front of you that if you do seek treatment, you get proper treatment, and you are resilient, that you can overcome. Because people out there right now are watching this show who've suffered a stroke. Never give up hope. Rehabilitation, belief in yourself. You can improve. And the extent to which everyone improves will be different. But there's always hope, and you're living proof of that.
Right, and your book, True Strength, which is fantastic. Again, it tells you it's really about you and how much you put into your
It's not a somber story, just so you know. I mean, there's a lot of humor in there. There's a lot of great anecdotes in there. But it is talking about leading up to that point with Hercules and getting the strokes and what I did beyond that. I decided I really want to get the story out here and let people see for themselves and hear for themselves, coming from someone that is so opposite of what we would expect to be a victim of strokes.
And not only getting this story out to the home audience, we are also giving. He's very generous, and we're going to give you all the book, True Strength.
But tell your friends to go buy it at Amazon or no Barnes & Noble.